Good afternoon, everyone. My name is Victoria Lay, and today I will be presenting about hepatitis B, the stigma surrounding this disease, and what we need to do to help alleviate this global health issue. So, here's a little bit about me. I am currently a rising senior at Saratoga High School in Saratoga. I have been part of my school's water polo team for 3 years and my school's swim team for 2 years. For the past few summers, I have helped spread awareness about hepatitis B through the Stanford Youth Leadership Conference and am currently on a medical mission in Vietnam. While I see patients during clinic in Vietnam, I pass out brochures about hepatitis B and inform them about this disease, its causes and consequences, and how to prevent it. I have also attended this global health conference before during my freshman year in 2020. Some topics that I am interested in are public, global health, and biosciences, and hope to be on the pre-medical track. Now, I'm going to talk more about hepatitis B, a global health issue because it is endemic in many countries, including Southeast Asia and many parts of Africa. Hepatitis B is a vaccine-preventable disease of the liver and leading cause of liver cancer caused by infection of the hepatitis B virus or HBV. Promoting hepatitis infection awareness in the public is crucial in the fight against the disease infection, progression, and associated stigma. Infectious hepatitis can be of 5 types, A, B, C, D, and E, of which type B, or HBV, is by far the most common cause of chronic infection and the leading cause of hepatitis-related illness, cirrhosis, liver cancer, and death. Infants and toddlers are most vulnerable to developing chronic disease if infected, with over 90% of infected being a chronic carrier, compared with 2 to 6% of infected adults. This disease can be contracted by blood, birth, and sex. As there's an effective vaccine against HBV infection, one of the main strategies in the fight against hepatitis B injection has focused on vaccination, especially in newborns. Many people do not test for hepatitis B, either because they do not know about the disease, they do not have money for vaccinations, or because of the stigma associated with the disease. However, it is important because this disease can be prevented from a single vaccination, and it will keep families closer, healthier, and happier. So, promoting hepatitis infection awareness in the public is crucial in the fight against the disease, infection, progression, and associated stigma. Now, I'm going to get into the social stigma associated with hepatitis B. Social stigma, as defined by the Oxford Dictionary, is a mark of disgrace associated with a particular circumstance, quality, or person. Patients with HBV infection feel a great sense of guilt, as they feel that they may bring harms to their loved ones. Many think that they should avoid hugs and kisses, while others think that HBV is shameful. Chronic carriers are denied jobs and face discrimination. In Guangzhou, China, mothers of HBV children are fearful that their children will be excluded from school over the possibility of spreading the infection. Furthermore, according to a recent study by Jane Smith Palmer, patients with chronic infectious disease can disengage from their interaction with healthcare professionals for fear of being recognized at the clinic by people in their circle of friends or acquaintances. The clinical implications in this case include further propagation of the disease and disease progression, which can lead to deadly consequences. The study suggested that hepatitis B-related stigma is often a consequence of lack of knowledge around the route of transmission. So, here is a study comparing the knowledge of HBV among Vietnamese American in Chicago and Vietnamese in Ho Chi Minh City, showing that Vietnamese in both cities showed substantial knowledge deficit on HBV transmission. More than 50% of participants in Ho Chi Minh City were unaware that HBV can be transmitted via intercourse. Clearly, much more emphasis needs to be made in educating the public about hepatitis, as ignorance is fertile ground for misinformation, vaccine hesitancy, development of stigma, and discrimination. The lack of public awareness on hepatitis infection, its national history, disease transmission, disease prevention, and treatment represent a significant challenge to the HWO's call for the elimination of the disease by 2030. Hepatitis prevention and treatment should be an integrated two-pronged approach: vaccination, and education. Although every country has a hepatitis awareness program, these efforts are often sporadic, haphazard, and often not well coordinated even within the same country. Hepatitis endemic countries need to create massive national informational campaigns to educate the public with focus on the underserved and vulnerable populations. The effort should be spearheaded and led by the public health ministry in each country. To assure consistency in the messages and accountability with an oversight committee embedded in the WHO. The country's healthcare workers, physicians, nurses, and social workers and other allied health professions need well thought out educational and training programs aimed to arm them with the knowledge and tools required to disseminate accurate information about the disease to the patients and their families. The educational campaign should also be integrated into the national vaccine programs. Every time a child is being vaccinated, we have the opportunity to teach his or her family about hepatitis treatment and prevention, and work to bring awareness about the stigma associated with the disease. The WHO and the individual country and local leadership should strive to leverage technology by partnering with social media companies to disseminate accurate information quickly and combat against false beliefs. So, here are some of the main takeaways from this presentation. Hepatitis B is a very serious yet preventable disease, making it important to spread awareness about vaccinations. Because of common misinformation, stigma, and ignorance about hepatitis B, this disease is known as the silent killer. As part of this effort, we need to develop leadership and educational programs for primary care physicians, nurses, social workers, and other allied health. These training programs should aim to arm these first-line professionals the knowledge and tools needed to spread accurate information about the disease to the patients and their families. We need to share information through publications and national meetings, as well as integrate efforts into countries' national hepatitis B vaccination programs. This would hopefully help with the spread of misinformation and the stigma associated with hepatitis B. Thank you so much for listening. If you would like, I have provided my email if you have any questions. Thank you so much.